that you brought up the pizza analogy, because you can rationalize your symptoms in many different ways depending on what you yourself are going through at that point. So you're absolutely right. March of 2020, and I had patients tell me this, that they would have chest discomfort, et cetera, and they would say it was probably the food I ate, it's probably stress, not sleeping well, and so on and so forth. And later you find out that this is the first signs of cardiovascular issues. So let's go back to, like you said, to the very beginning. So for me and for most cardiologists, and we have to do a better job at public information, disseminating this out to the public. If you have chest pain, chest pressure, if you have arm numbness, jaw pain, nausea, diaphoresis where you're sweating, shortness of breath with exertion, shortness of breath when you lay flat at night, palpitations, unexplained episodes of passing out, or even sort of seizure-like activity, you should absolutely seek medical attention, and you should do it sooner rather than later, before you start rationalizing. And then more subtle signs. So if you feel more tired, more fatigued at the end of the day, if you feel that, I used to be able to walk up and down this corridor at work, or I used to be able to climb a flight of stairs, and now I have to take a break in the middle. Don't rationalize it as I'm a year older. Maybe I've gained the COVID 15 pounds and I'm a little heavier. It's easier. It's very easy to rationalize. What you actually should do is go out, seek medical attention, and then make sure it's not anything we need to worry about. All the other things, let's rule it out first, and then go with I'm just deconditioned. I just need to lose a little bit of weight. It's stress and anxiety. Those things won't markedly alter your mortality and morbidity the way heart disease potentially can. And remember, early intervention is always better. Whether it's cancer, whether it's heart disease, the earlier you find something, the more options we have, and the better chance we have at preventing something worse.
Yeah. And I think you hit on something really important. There's the early intervention. Don't talk yourself out of talking to a doctor. The worst case is he tells you you're perfectly fine, go home and leave me alone. And that would be a great case.
And we get that all the time. We get patients who come in and they have chest discomfort. We do the evaluation. It's not the heart. And what we tell them is, look, I understand you had symptoms of XYZ. What I can tell you is it's not the heart. What it could be, I don't know for sure, but let's take the next step at going back to your primary care doctor, letting them know that you had a battery of cardiovascular tests. We don't think it's your heart. Let's go down the next thing down the line.